Welcome to the WeightWise Bariatric Program free informational seminar. Congratulations on taking this first step toward transforming your life. The goal of this seminar is to provide you with essential information about obesity and what it means in today's world. We will explore why weight loss surgery is statistically the most effective option for achieving significant, long-term weight loss. You'll learn who qualifies for bariatric surgery, as well as the different surgical options available. We are here to guide you through the steps needed to prepare for a safe procedure, achieve lasting success, and understand why WeightWise is the trusted choice for your weight loss journey. Obesity is a medical condition, a disease. It becomes serious when excess weight begins to negatively impact a person's health. To help assess this, we use the Body Mass Index, BMI, which classifies individuals based on their height and weight. While not a perfect measurement, BMI provides an objective metric to evaluate the risk of disease, mortality, and potential surgical complications. Most importantly, obesity is a disease, not a character flaw or a lack of willpower. Suggesting that it can be treated with willpower alone is as misguided as prescribing willpower to treat cancer or diabetes. Yet, for the past 30 years, that has been the prevailing and ineffective approach. People do not choose to be obese, just as no one chooses to have diabetes. Obesity arises from complex factors, many of which lie beyond an individual's control. It is not simply a matter of calories, though calories play a role. It is not just about lifestyle, though lifestyle changes are often necessary. And it is not a question of willpower, though persistence is essential for long-term success. Most importantly, obesity is not a character flaw, despite the stigma that continues to surround it. At its core, obesity is a disorder of brain and hormone regulation, much like diabetes or hypothyroidism. It occurs when the body's metabolism shifts, burning less energy while driving greater hunger. In other words, obesity is a chronic hormonal disease. Fortunately, we now have safe and effective treatments to help manage it. Obesity is a disease of excess hunger, even in the presence of abundant stored energy in the form of fat. Our bodies regulate weight through a metabolic set point, which finally adjusts hunger levels and controls when, how much, or even whether or not energy is burned. The challenge is that this set point works like a one-way street, meaning it can rise, but it rarely comes back down. When a person with obesity tries to lose weight, the body resists, hunger intensifies, and energy expenditure drops. The result is the perfect storm, and why they continue to gain weight. In this next video, we'll take a closer look at how this process works and why it makes obesity such a difficult disease to treat.
Let me introduce you to Amanda. You're just meeting her for the first time, but chances are you're already making assumptions about how much she eats and how little she exercises because she's obese. But I'm about to show you that there's much more than meets the eye when it comes to obesity. There are lots of Amandas out there, and they need treatment. Maybe you're one of them, or maybe you know an Amanda. It's time to act on obesity. But in order to do so effectively, we need to understand obesity. It's generally accepted that body weight is determined by a pretty simple formula. We call it the energy balance equation, and it works like this. If the number of calories that you consume equals the number of calories that you burn, your weight remains the same. If you consume more than you burn, you gain weight. And if you burn more than you consume, you lose weight. Most people think that those of us who properly manage our energy balance remain lean, whereas those of us, like Amanda, who eat too much and exercise too little, become obese. We view obesity as a lifestyle choice, and the cure for it is simple: eat less and exercise more. This may sound logical, but it's wrong. Let me explain. First, let's talk about set point. No, I'm not talking about the point in a tennis match when one player is about to beat the other. I'm talking about a theory that says that no matter what you consciously want your weight to be, your brain has its own sense of how much body fat it should have on board, and it has a complex system in place that very precisely regulates your energy intake and expenditure to keep you within a so-called set point range for body fat. So that whole energy balance equation, it's not something that you control voluntarily. Your brain regulates your calories in to your calories out for you. For your brain to do this, it needs to know how much energy you have on board at all times. And it knows this by listening to hormones like leptin, which is made in your body fat. You can think of it like a car. Leptin is the gas gauge that tells your brain how much gas is in your tank. But leptin is just one piece of the puzzle. You've got a whole bunch of other hormonal signals and sensors that are involved too. Your bones, muscles, pancreas, liver, GI tract and sensory organs, they all play a role, communicating with your brain to give it the information it needs to do its job. But that's more detail than we need for this conversation. The point is that you have a complex system in place that regulates you to within a set point range for body fat. So what happens if Amanda decides to lose weight by going on a diet? After all, people with obesity should eat less, right? Here's what happens. She loses weight, but her hormone levels change. Her brain hears this, and it starts acting to restore whatever body fat she's lost. She feels hungrier, and although she doesn't know it, she's also burning fewer calories than before. You see, set point is usually a one-way street. Once it's been elevated, the brain works to defend it just as vigorously as it would a lower set point. Amanda's brain doesn't know that she needs to lose weight. It only knows to defend her current set point. Back to our car analogy. Amanda can't help but look for a gas station to refuel when she sees that her gas gauge is low. At the same time, she becomes more fuel efficient, burning less energy than before. This might explain why treating obesity with diet and exercise so often fails to produce the desired results. It's sort of like telling Amanda that she needs to be a more careful driver, when the real problem is that she needs a mechanic to fix her car. Okay, so if we've all got this complicated system in place that prevents us from losing weight, why doesn't it also protect us from gaining weight and developing obesity in the first place? How can we explain the obesity epidemic? Getting back to Amanda, why did she develop obesity? The answer is that it takes a perfect storm to cause an obesity epidemic like the one we're seeing now. And it's our modern environment that places us, and Amanda, directly in the path of that storm. While there's no single cause for the rising rate of obesity, changes to the chemical and nutrient content of our food, the so-called Western diet, a decrease in physical activity, increased levels of stress, inadequate and disrupted sleep, and more widespread use of medications that promote weight gain all play a role. Our unique genetics and developmental histories cause each of us to respond differently to these elements of the modern environment, and some of us, like Amanda, respond by sending hormonal signals that elevate our set point for body fat. It's not that Amanda's system has stopped working. It's just that it's working to regulate her to a set point that's too high. So you can think of obesity as a biological response to the modern environment, a disease where the body dysregulates to a body fat set point that is too high. Back to our car analogy. The size of Amanda's gas tank has expanded, so she carries around too much fuel. So now that we've looked at one of the theories behind why obesity occurs, let's look at theories of how it occurs. It's often assumed that obesity in people like Amanda is a result of a massive imbalance to their energy balance equation, that their intake vastly exceeds their expenditure. But is this always the case? Consider this. If you're an average person, you consume about 900,000 calories per year. And it's true that you need to burn 900,000 calories to avoid gaining weight. If your energy balance were to be off by only 4,000 calories, an error term of less than 0.5%, you'd gain a pound every year. If you break that down, we're talking about a mismatch of 11 calories per day, the equivalent of approximately 2 potato chips. If your intake were to exceed your expenditure by just 40 calories per day, the equivalent of 1 pretzel rod, you'd gain about 150 pounds between age 25 and 65. So there are 2 points here. 1. If you're maintaining your weight, you're doing so because your body is matching your energy intake to your energy expenditure more precisely than you could ever do consciously. So it stands to reason that your system plays a role in doing it for you. And 2, people may gain weight not because their energy intake wildly exceeds their energy expenditure, but because of a very slight mismatch between the two. For Amanda to lose weight and keep it off, she needs to find a way to lower her set point. That is, rather than declaring war on her own biology, she needs to find a way to make her body regulate itself to a new, lower weight.
When we look deeper into the causes of obesity and the perfect storm, we see why breaking through the metabolic set point and sustaining long-term weight loss is so difficult. Our modern food supply plays a major role. Ultra-processed foods rich in sugars and fats create a cycle of hunger and fat storage that is hard to escape. Once we eat these highly palatable foods, our bodies continue to crave them, reinforcing the set point. Genetics also contribute. For example, if both parents are morbidly obese, their children have an 80% chance of becoming morbidly obese themselves. If only one parent is affected, the risk is about 40%. While there are known genetic abnormalities that can lead to obesity, they are quite rare. Stress is another key factor. Stress hormones, especially cortisol, trigger increased hunger, which often leads to consuming those same high-calorie, highly palatable foods. Similarly, certain medications, including some commonly prescribed for diabetes, pain, and hypertension, can promote weight gain. These are prescribed without regard to their effect on obesity, which ironically worsens the very disease being treated. Poor sleep further compounds the problem. Lack of quality rest elevates stress hormones and can even contribute to heart dysfunction. Sleep apnea, in particular, is strongly linked to weight gain, a topic we'll explore in more detail shortly. Finally, we must address decades of miseducation. We've all heard the advice, eat less, move more. Low-fat, low-calorie diets and punishing exercise regimens seem logical, but in practice, they backfire. Restrictive diets stimulate hunger, while intense exercise can increase appetite, making weight loss harder to sustain. That's why our goal at WeightWise isn't to work harder. It's to work smarter and to give you the tools to take back control of your health. Obesity doesn't just affect weight, it drives disease. In fact, there are around 40 different conditions caused or worsened by obesity. Let's look at a few of the most common. Type 2 diabetes is, at its core, a disease of obesity. Excess weight makes it harder for the body to use insulin effectively, leading to high blood sugar. About 85% of people with type 2 diabetes have it because of obesity. Obstructive sleep apnea often starts with snoring, but it's much more serious than just disturbing sleep. Sleep apnea causes repeated drops in oxygen during the night, damaging organs throughout the body. Over time, it can lead to heart failure. Polycystic ovary syndrome is a hormonal disorder in women that can cause irregular periods, excess male hormones, and infertility. PCOS is part of the same spectrum as insulin resistance, metabolic syndrome, and eventually type 2 diabetes. Weight loss can often improve or resolve PCOS and help regain fertility. GERD happens when the muscle at the bottom of the esophagus doesn't close tightly, letting stomach acid flow back up into the esophagus. Extra weight in the abdomen puts pressure on the stomach, making these symptoms worse. Heart disease is caused by fatty plaque building up in the arteries, which makes it hard for blood to flow, causing the heart to work harder. A stroke happens when a blood vessel in the brain becomes blocked or burst. Obesity increases the risk of high blood pressure, diabetes, and clogged arteries, all of which make strokes more likely. Hypertension or high blood pressure happens when extra weight makes the heart work harder to pump blood. This can, over time, damage blood vessels and organs. Cancer is another major link. At least 13 types of cancer are associated with obesity, and these are among the only cancers with rising rates of both diagnosis and death. The why is still being studied, but the evidence is undeniable. Studies show that people who undergo bariatric surgery have a significantly lower risk of dying from cancer compared to those who qualify for surgery but don't have it. Here's the hopeful part. All of these conditions can improve or even be cured with significant weight loss. Many insurance companies recognize this, covering weight loss surgery when these health problems are present. At WeightWise, that means you may have a covered path to better health. We know what causes obesity, but what are the consequences? For people who are morbidly obese, life expectancy is shortened by about 14 years compared to those at a healthy weight. The risk of death rises sharply with every increase in BMI above 40. Beyond the higher rates of disease and premature death, obesity carries other heavy penalties. Globally, studies show that overweight women earn about 11% less than women of healthy weight. Discrimination extends beyond salary to lost opportunities as well. In fact, Obesity may be one of the last widely accepted forms of prejudice in the United States. The financial cost is also staggering. According to the CDC, individuals with a BMI over 35 spend an average of $15,000 more per year than their lower weight peers, most of it on medical expenses. And the burden isn't just on adults. Obese teens and preteens often endure bullying and stigma. Even more concerning, while adult obesity rates have doubled in the past 15 years, obesity among children and adolescents has tripled. The obesity epidemic shows no signs of slowing. What are GLP-1s? GLP-1 medications are drugs that bind to GLP-1 hormone receptor sites, essentially mimicking the action of the body's own GLP-1 hormone. GLP-1 is one of about 40 hormones that change dramatically after weight loss surgery. GLP-1 receptors are found throughout the body, including in the brain, stomach, and pancreas, which are some of the key players in hunger and metabolism. These drugs have been around for over a decade and were originally developed to treat type 2 diabetes. Over time, they've evolved into powerful tools for weight loss. The newest versions can help people lose up to 18% of their total body weight, a huge improvement over older medications. For people who need to lose 30 to 50 pounds, GLP-1 medications can be a good place to start. But real-world results don't always match clinical trials. A large study in New York followed 58,000 patients on GLP-1 therapy. After 2 years, average weight loss was only about 4% of total body weight. The difference comes down mostly to dropout rates, as more than half of patients stopped treatment within the first year, usually because of side effects or cost. Even among those who stayed on the medication for a full year, average weight loss was only about 8%. Common side effects include nausea, vomiting, severe reflux, and constipation. And in many regions, insurance coverage is limited, making out-of-pocket costs very high. Another challenge with GLP-1s is that the body often adapts to these medications over time, reducing their effectiveness. This makes sense when you consider how adaptable our bodies are to lifestyle changes, diseases, medications, and even surgery. The difference with weight loss surgery is that it resets multiple systems at once, changing around 40 different hormones. The body does adjust during the first year after surgery, but instead of returning to the old metabolic set point, a new, lower set point is usually established. Right now, surgery remains the only proven way to create a long-lasting reset of the body's set point. Bariatric surgery provides long-lasting results, with sustained weight loss of 25 to 35% of total body weight. While GLP-1 medications can offer metabolic benefits, these improvements don't always last. When GLP-1 therapy is stopped, most patients regain the weight they lost, returning to their old metabolic set point. Bariatric surgery can greatly enhance quality of life by improving mental health, boosting energy, and making everyday activities easier and more enjoyable. As we've discussed, bariatric surgery establishes a new metabolic set point, helping the body maintain its lower weight. By comparison, the cost of just 1 to 2 years of GLP-1 therapy can pay for the cost of bariatric surgery at WeightWise. Surgery also lowers healthcare costs from obesity-related diseases. We also have decades of data proving the safety and effectiveness of bariatric procedures, while long-term data on weight loss-focused GLP-1 medications is still limited. Another great benefit of bariatric surgery is that it is a one-time procedure. While it requires commitment, it does not require lifelong medication or injections. Lastly, it is often covered by insurance, whereas the coverage for GLP-1s is very limited. In the 1990s, the National Institutes of Health held a consensus conference to establish criteria for who qualifies for bariatric surgery. These criteria have been reaffirmed every decade since. If your BMI is over 40, you qualify based on weight alone. For those with a BMI between 35 and 40, at least one serious weight-related condition is required. Common examples include moderate to severe sleep apnea, congestive heart failure, type 2 diabetes, or difficult-to-control high blood pressure. Despite the fact that these operations have become much safer and the population significantly more obese, insurance coverage often still lags behind. Most insurance companies that offer bariatric surgery benefits follow some version of the National Institutes of Health criteria when determining eligibility. At WeightWise, however, we take a more individualized approach. Our guidelines expand the pool of eligible candidates, ensuring more people have access to the care they need. There are several bariatric operations that are widely accepted as safe and well-studied. While many other procedures exist, only a select few are recognized and recommended by our national society. Let's take a closer look at these options. The Roux-en-Y gastric bypass is considered the gold standard of weight loss surgery. It was developed from earlier procedures, keeping the benefits and eliminating the downsides. Here's how it works. A small pouch is created from the top part of the stomach, so food bypasses most of the stomach and the first part of the small intestine. The intestine is divided, and the lower portion is connected directly to the pouch, while the upper portion is reconnected further downstream, about a third of the way along. This operation has been performed for over 40 years, and the data supporting it is extensive. The results are impressive. Patients experience significant long-term weight loss, and type 2 diabetes improves or resolves in up to 80% of cases. It's also an excellent treatment for reflux. And because of a side effect called dumping syndrome, patients are naturally discouraged from eating foods high in sugar and carbohydrates, further supporting long-term success. The sleeve gastrectomy exploded onto the weight loss surgery scene around 2007, and by 2014 it had become the most common bariatric procedure worldwide. In this operation, about 80% of the outer curve of the stomach is removed. The appeal is its simplicity. Unlike the gastric bypass, the gastrointestinal tract isn't rearranged. The sleeve delivers excellent weight loss results, but it does have some limitations. Over the medium to long term, results may not be quite as durable as those seen with the gastric bypass or the single anastomosis duodenal switch. When it comes to reflux, outcomes are mixed. Some patients see their reflux improve, while others develop new or worsened reflux symptoms. The sleeve also provides good resolution of type 2 diabetes, though in some cases the gastric bypass performs slightly better. And while results so far are promising, we don't yet have very long-term data, 20 years or more, on how well the sleeve maintains weight loss over time. The single anastomosis duodenal switch is a modern modification of a long-standing procedure called the duodenal switch. Here's how it works. A sleeve procedure is performed on the stomach, then the intestine is divided only one time, just past the stomach, and a loop from the end of the small bowel is connected to the duodenum. This creates 300 centimeters of a common channel for digestion and absorption to occur. By combining a sleeve gastrectomy with a malabsorptive component, it offers a powerful tool against severe obesity. Unlike the gastric bypass, this procedure usually does not cause dumping syndrome, and patients can still take anti-inflammatory medications if needed. While the single anastomosis duodenal switch is relatively new, this modification has become an important addition to our arsenal against morbid obesity. The lap band received FDA approval in 2000. At the time, it was the only real alternative to a gastric bypass, and it quickly grew in popularity, at least until the gastric sleeve came onto the scene. The band is placed around the upper part of the stomach to create a small pouch to hold food. It doesn't permanently alter the gastrointestinal tract, which initially seemed like a major advantage. But those same features also limit its effectiveness. For about 20% of patients, the lap band works as well as other bariatric operations. But for the majority, it leads to very little weight loss, which is a source of frustration for both patients and their care teams. Another drawback is its higher reoperation rate compared to other procedures, usually due to complications. While most of these complications aren't life-threatening, they often require surgical correction. Because of these complications, use of the lap band has dramatically declined. Over the last few years, the operation has been performed mostly to remove bands and convert patients to more effective weight loss procedures. At WeightWise, we do not offer lap band placement. However, we do offer to remove it or revise to a different surgery type. Revisional bariatric surgeries generally fall into two categories. The first is to address ongoing complications from a previous weight loss operation. The second is for patients who have experienced weight regain or did not achieve enough weight loss the first time. At WeightWise, we address both. It's important to know that revisional procedures can carry a slightly higher risk of complications compared to a primary surgery, and the weight loss results may not always be as strong. That said, there are many different revision options available, and they can often make a significant difference. If you're considering a revisional operation, we'll take the time to discuss your situation one-on-one, tailoring the plan to your unique needs and circumstances. At WeightWise, we are proud to maintain an exceptionally low rate of serious complications. While our goal is always zero complications, the reality is that all surgeries carry some degree of risk. Across the country, the mortality rate for bariatric surgery is about 0.2%, the same or even slightly lower than gallbladder removal, which is about 0.3%. To put that in perspective, at WeightWise, after nearly 10,000 operations, our mortality rate is just 0.01%, an extraordinarily low number. One of the most serious risks is a leak. This happens if the staple lines do not heal properly. We test every staple line before finishing surgery, but occasionally healing can be incomplete. A leak may require anything from a few extra hospital days to an ICU stay. Fortunately, our leak rate is only 0.4%, meaning a 99.6% chance of no leak. The second most common complication is bleeding. While it can be alarming, it typically only requires a short hospital stay. Other potential risks are less common. Pneumonia is now extremely rare thanks to laparoscopic surgery. Blood clots, or DVTs, can occur and may travel to the lungs, causing a pulmonary embolism. These are serious but very uncommon. We take universal precautions to prevent clots and provide extended protection for patients at higher risk, which has kept our rates very low. Infections are also rare with laparoscopic surgery and, when they occur, are usually easy to treat. Another possible complication is a stricture, or narrowing of the esophagus, most often seen where the stomach connects to the intestine in gastric bypass patients. Early strictures are easily treated with dilation, but strictures that appear later are usually caused by chronic irritation from medications or lifestyle factors and can sometimes require revisional surgery. While risks exist with any operation, bariatric surgery at WeightWise is very safe, and our team is here to support you every step of the way. Your journey begins with a consultation with a WeightWise provider. During this visit, we'll learn about your health, lifestyle, and goals, then recommend which operation is best for you. Once we agree on a plan, we'll map out the steps to get you safely to surgery. The time from consultation to operation can vary. Factors like your health, pre-existing conditions, and even insurance requirements all play a role. On average, the process takes about 100 days. Along the way, you'll meet monthly with our team of nurse practitioners, dietitians, and exercise physiologists and attend support groups. We'll order labs and any necessary tests to ensure you're healthy and ready for surgery. Most patients will be asked to lose some weight before surgery, but this is individualized. This helps make the operation safer by creating more room in the abdomen. We believe this preoperative process is one of the main reasons WeightWise has such low complication rates and excellent long-term results. Once the preoperative process is complete, you'll return for a final pre-op visit with Dr. Walton. At this appointment, we'll review your medical history and records one last time, answer any remaining questions you may have, and make sure you feel fully informed and comfortable with the risks and benefits of surgery. Our goal is to ensure that everything is in place so that your surgery day goes as smoothly as possible. Most patients stay in the hospital for 2 nights and are ready to go home the morning after their second postoperative day. We don't place strict physical restrictions on you, but even our most motivated patients usually need 5 to 7 days before returning to work. By 2 weeks, about 80% of patients are back at work and resuming normal activities. Consistent follow-up is one of the most important keys to long-term health and lasting success after surgery. Yes, we check labs on a regular schedule, but the real value of follow-up is accountability, helping you stay committed to the 4 pillars of success. 10 years from now, if you've maintained your weight loss and health improvements, it will be because you built lasting habits that keep hunger under control and allow your body to function as an efficient fat burner. The secret is ritualizing the 4 pillars so they become part of your daily life. The 4 pillars of success are: 1. Eat a low-carbohydrate diet. 2. Drink at least 96 ounces of non-caloric, non-carbonated fluids each day. 3. Exercise 30 minutes daily at a mild to moderate pace. Walking is perfect. 4. Stay engaged with follow-up visits and support groups. The world around you will constantly challenge these rituals. Even well-meaning friends, family, and coworkers may unintentionally undermine your efforts. That's why consistency and accountability are so important. Another challenge is what we call the honeymoon effect. After surgery, your metabolism undergoes a dramatic shift. Fat loss accelerates, and hunger is almost eliminated. This period is powerful, but temporary. Around a year after surgery, your metabolism adapts and begins to stabilize. At that point, the rituals you built during the honeymoon phase combined with the excellent tool the surgery provides become your foundation for lasting success. Dr. Walton earned his medical degree from the University of Oklahoma in 1989. He completed his general surgery residency in Birmingham, Alabama, where he was first introduced to bariatric surgery. Inspired by its life-changing impact, Dr. Walton began performing bariatric procedures alongside his general surgery practice in Enid, Oklahoma. In 2006, he and Dr. Broussard founded the WeightWise Bariatric Program in Oklahoma City, which has since grown into one of the region's premier practices, performing more than 9,500 successful surgeries. Over 5,000 of those surgeries Dr. Walton has performed as the primary surgeon. Dr. Walton is a fellow of the American College of Surgeons and an active member of multiple professional societies. Paying for weight loss surgery is one of the most common concerns we hear from patients. At WeightWise, we strive to make it as affordable and accessible as possible. Most people fall into one of three main categories of coverage, which we'll review with you in detail. At your initial consultation, you'll be paired with a personal patient advocate who will guide you through the entire process and answer any financial questions specific to your situation. Your advocate will also provide a clear breakdown of costs for your case, and if needed, connect you with financing options. For more details on general financial information, including our complication insurance and a money-back weight loss guarantee, please visit our website, www.weightwise.com. At WeightWise, our mission has always been more than just performing safe surgeries. We're committed to helping our patients achieve substantial, sustainable weight loss that lasts a lifetime. We take a long-term view of success, which means surrounding you with a full team of in-house specialists, nurse practitioners, dietitians, exercise physiologists, and a psychologist, all focused exclusively on weight loss and bariatric care. We perform nearly all of our procedures at Summit Medical Center, a physician-owned surgical hospital. While some people may be concerned about its smaller size, this is actually one of our greatest strengths. With over 20 years of experience, almost 10,000 operations, and an exceedingly low complication rate, our results speak for themselves. A dedicated team working together day after day on the same highly specialized procedures creates the safest environment and the best outcomes for our patients. Now that you have a better understanding of WeightWise, our process, and the role of weight loss surgery in treating obesity, it's time to take the next step. Your journey begins with an initial consultation with Dr. Walton. Our office will reach out to you within 72 hours of viewing this seminar to schedule your appointment, or you are welcome to call us directly. In the meantime, you can begin incorporating elements of the WeightWise 4 pillars of success by visiting our online store for protein supplements and vitamins. Adopting these diet changes and habits now will help your journey be as seamless as possible. As you move forward, staying organized will be essential. At your initial appointment, you'll receive a lot of information and documents. A binder or folder is an excellent resource for keeping track of your preoperative checklists and the materials you'll receive from your care team along the way. Our entire team is excited to partner with you on this life-changing journey. We look forward to seeing you soon.